Hi, this is Andrew Vasta with New Jersey Medicare Brokers. Today I'm going to go through a 101 on Medicare to help you understand all your options available through the Medicare programs parts A, B, C, and D. Whether you are new to Medicare or have been on Medicare for many years, this is an educational video to help you understand your options. And we'll be going through all the details and having short videos available of the specific parts if you'd like to tune into those instead. But for a full presentation, tune into the rest of this video or check us out on njseniorhealth.com. So when you first turn 65 or first getting Medicare, this is probably what your mailbox looks like. Every single insurance company mails you all their plan details with the benefits, but not the drawbacks. And you're getting information about Medicare Advantage, Medicare Supplement, Medicare drug plans. And you're overwhelmed. It's a lot of companies bombarding you with information. You do get the Medicare and You booklet in the mail as well, which has all the information in there, but it's very thick and in insurance language, so it's hard to understand your options. And actually in New Jersey for this year, there are 14 drug plans, 12 different Medicare supplement plans insured through 24 different companies, and there's 56 different Medicare Advantage options, which vary based on the county that you live in. So in total, there's over 1,000 different ways that you can get your Medicare, whether it's one company or another. And we help people navigate all the options to figure out which plan makes sense for their specific needs, because Medicare is not a one-size-fits-all program. Everyone has different healthcare needs, financial limitations, prescriptions, doctor, hospital, and healthcare providers. A lot of decisions go into your Medicare plan and what makes sense for your specific needs. So we help people navigate through this maze and understand their options to figure out the plan that works for them. So when does Medicare start? You're eligible for Medicare to start the first day of your 65th birthday month. The only exceptions are if you were born the first day of the month, they actually backdate your Medicare to the month before. So if you're born July 1st, Medicare will begin June 1st when you turn 65 or about to turn 65. The other way you can qualify for Medicare is if you're on Social Security disability for 2 years. Then at that point, if you're under 65, you can qualify for Medicare through disability. You do have to be a U.S. citizen or a legal resident who has lived in the United States for at least 5 consecutive years. So with Medicare, this is just an example of a Medicare card. There's Parts A and Part B. And A is for hospital and B is for medical. And this is what you get from the government. So health insurance through the government. There's no charge for Part A as long as you or your spouse have worked in the country for 10 years. And there is a monthly fee for Part B, which we'll get into. You get a Medicare number, a random assortment of numbers and letters. And on your card, it has the effective dates of Part A and B. Medicare Part B has a monthly fee to it. If you're collecting Social Security, this monthly fee comes out of your Social Security check. If you're not collecting, then you get a quarterly bill. And it's based on your income from 2 years ago. So your 2024 modified adjusted gross income. If you filed individual taxes and your income was less than $109,000, or if you file jointly and you're below $218,000, then the standard amount for Medicare is $202.90 per month. If your income was higher than that, then they add a surcharge called IRMA on top of the standard amount. And as you can see here, that premium quickly gets more expensive with the more money that you make. But if you've had a life-changing event, such as a work stoppage or work reduction, you can have that amount reduced to your expected income for 2026 instead of from 2 years ago. There's a form you fill out called a life-changing event form that you submit to Social Security to have it adjusted down. But if your income is higher, then you have to pay more for Medicare. When you are first turning 65, you have a decision to make about Medicare. You have the option that you can delay Medicare enrollment or enroll in Medicare. If you're still working or your spouse is still working, you can delay enrollment. you have the option to delay all of Medicare, Parts A and Part B, or just the Part B. Medicare Part A is for hospital coverage, and there's no charge for Part A of Medicare. So most people just take Medicare Part A when they are turning 65 and delay the Part B in the situation where they have employer coverage. The only exception to this is if you have an HSA, a health savings account. You can no longer contribute to a health savings account if you are on Medicare Part A. So if you are on an HSA, you may want to take none of Medicare so you can continue to contribute. But if not, you could take just the Part A and delay enrollment in Part B of Medicare. You do have to enroll in Medicare if you work for a small employer, you're on a retiree plan, you have insurance through the Affordable Care Act or New Jersey Family Care, or if you're on COBRA. Then you do have to apply for Medicare at age 65. If you have employer coverage, you have the choice to stay on the employer coverage or enroll in Medicare Parts A and B. Employer coverage through yourself or your spouse, and you will not be penalized if you delay the enrollment in Medicare because you have creditable coverage, and whenever you retire, at that point you can apply for Medicare without being penalized. The employer does have to be above 20 employees for it to be considered creditable coverage, and COBRA is not considered creditable coverage. So how do you apply for Medicare? If you are collecting Social Security benefits at age 65, you'll automatically get a Medicare card in the mail, actually 3 months before your 65th birthday month. And so if you get a card, it will have A and B on it. It may make sense for you to not take Medicare because you're collecting Social Security, but you're on your spouse's employer coverage, and therefore you can continue to stay on their coverage and delay enrollment in Medicare. If that's the case, then you can return the Medicare card and they'll send you a new one with just Part A, because Part A is for hospital and there's no charge for it, and they'll take off the Part B of Medicare. If you are not collecting Social Security and you are turning 65, you have to apply for Medicare online. So on Social Security's website, ssa.gov/Medicare, you can apply for Medicare on their website. If you are delaying Medicare until after you retire, after age 65, you'll actually go to your local Social Security office, or you can fax or mail these forms in. But one form that you fill out, one that your employer fills out, just saying that you've had insurance through them ever since you turned 65, and then your local Social Security office will process your Medicare enrollment. If you worked for the railroad, you may be eligible for railroad retirement benefits, and instead of Social Security, you'd apply for Medicare through railroad retirement benefits. Medicare is not the same as Medicaid. These terms get interchanged sometimes, but they're not the same programs. Medicare is federally administered, and it's for people age 65 and older, people who are on Social Security disability for 2 years, or those diagnosed with ALS or end-stage renal disease can qualify for Medicare without a 2-year wait. Medicaid, on the other hand, is offered through the state. So this is an example of a New Jersey Medicaid card, and it's for health insurance for individuals or families with limited income and low assets. You can be eligible for Medicaid and Medicare, and there's dual eligible plans available for those people. So with original Medicare, there are out-of-pocket costs that are not covered. And it is good health insurance, but not everything is paid for. So if you are hospitalized with just the red, white, and blue card Medicare, you have a deductible of $1,736 per stay in the hospital. That then covers you for 60 days. If you're still in the hospital after 60 days, you can start incurring a daily fee. If you're there for an additional 60 days, you'd have a higher daily fee. And then if you're there for exhausted those benefits, then you start incurring all the costs for the hospital stay. For medical, there's a $283 deductible once a year. Then Medicare covers 80% of medical bills, and you're responsible for 20%. So you have a decision to make with Medicare. You can have Medicare, and then you have the option to add on a Medicare supplement, also called a Medigap plan, to cover the 20% and cover the hospital deductible and out-of-pocket costs that aren't covered by Medicare. And then add on a separate plan for prescriptions, Medicare Part D. These are through private insurance companies, and they're add-ons to Medicare. The other option you have is what's called Medicare Advantage, where you get all your Medicare through a private insurance company. These plans are HMO or PPO, meaning you have network restrictions of which healthcare providers accept the coverage. And they are more pay as you go, so you have co-pays and out-of-pocket expenses as you use the coverage. Prescription drugs are usually included with Medicare Advantage plans, so you don't need a separate plan for medications. And there are additional benefits that can be included with Medicare Advantage plans that are not included with original Medicare. So your main decision with Medicare is, do you want to have Medicare and add on a supplement and add on a prescription plan, or to have it all wrapped into one package with a Medicare Advantage plan? I'm going to go through all these three options in more details. So first off, Medicare Supplement plans. Medicare Supplement plans in New Jersey, they ask health questions in order for you to qualify in most situations, but medical questions are not asked to qualify if you are turning 65. You have a 6-month window where you don't have to answer health qualifying questions in order to take the insurance. If you're enrolling in Medicare Part B for the first time, so if you delayed Medicare Part B and are retiring now and taking Medicare Part B for the first time, you have no health questions asked. If you lost creditable coverage, or if your plan is being discontinued, you have a 2-month window where you can take certain plans with no health questions asked. Finally, for people that are turning 65 and take a Medicare Advantage plan, you have a 1-year trial period where you can take a Medicare Advantage plan and go on the supplement plan within the first year without health questions asked. If none of those situations apply to you, then you'd have to answer health underwriting questions. They'll go through your whole health history to determine if you're accepted or not. You can be denied or charge a higher premium if you do have a health condition, and smokers will pay a higher rate than non-smokers. They ask anything major going on with your health. If you just take a couple blood pressure medication or cholesterol medication, that's not going to be a big deal, but they ask, within the past 2 years, have you had any major health conditions? Some conditions are within the past 5 years, or at any time have you had health conditions? So each company asks different questions to qualify, and one carrier may accept you, whereas another carrier may not. If you're coming off of creditable coverage, then there's pre-existing conditions will be paid for. But if you are not coming off of creditable coverage, pre-existing conditions would not be covered for the first 6 months. Medicare supplement plans are standardized, so there's plans A through N with some letters missing in there. Anybody that is new to Medicare after 2020, the plan C and the plan F are no longer available to individuals in that situation. Today I'm going to go through in more details the plan G, the plan N, and a high deductible plan G. Additionally, for people who are eligible for Medicare based on disability, the only option available in New Jersey is Medicare Supplement Plan D. So I'll explain the details of that option. Medicare Supplement Plan G has the deductible with Medicare is not paid for of $283. After that's been reached, you have no additional out-of-pocket costs for doctor, for hospital. As you can see here, the columns, Medicare pays, the Plan G pays, and you pay. So in the you pay section, the last column, you pay zero for any additional out-of-pocket costs after the deductible is reached. You can also see any healthcare provider that takes Medicare. So regardless of which Medicare supplement company you have, as long as the doctor takes Medicare, they have to accept the secondary Medicare supplement plan. Medicare Supplement Plan N is a lower monthly fee, and it has the same deductible of $283. After that's been reached, you owe $20 co-payments for the primary doctor, $20 for a specialist. If you went to the emergency room, you'd owe $50, but you would owe nothing for the hospital stay. And if you're admitted to the hospital, you actually get the $50 waived. And if a doctor accepts Medicare, but not the payment from Medicare, they can add on an excess charge of up to 15%, which would be your responsibility. Whatever Medicare approves for the medical service, the doctor can add on an additional 15%. This is pretty rare to see. On Medicare's website, you can look up whether your healthcare providers accept the payment from Medicare. If they accept assignment, that means they accept the payment from Medicare. If they, on the Medicare website, if they do not accept assignment, it will indicate that they may charge above what Medicare approves. There's also a high deductible option, which is less per month again. With this plan, you'd owe the initial $283. After that, Medicare kicks in and pays 80% of medical bills, and you're responsible for 20% of medical bills. You're responsible for the deductible for a hospital stay of $1,736. But the reason this is a decent option for a lot of people is because once you've paid $2,950 out of pocket, then the plan kicks in and you owe no additional out-of-pocket costs. So it's lower monthly fee, but higher risk because you could end up paying $2,950 for the year. However, that's the cap of how much you can spend per year, and after that, everything else is paid for. Again, the Medicare Supplement Plan D is the only option available for New Jersey residents who qualify for Medicare due to disability. It has the $283 deductible, and then no additional out-of-pocket costs for a doctor or hospital stay, but that excess charge could be applied if a doctor charges above the Medicare approved amount. And you are able to see any healthcare provider in the country that takes Medicare. It's important to shop the plans around, both initially when you first qualify for the coverage and for Medicare, or you can shop it around in the future. Medicare supplement plans can be changed at any time, but after that initial no health questions asked window, you can switch the coverage, but you have to answer the health questions. And if you're in decent health, your plan may have started as the lowest cost option, but it may have gone up to $189 per month, where another carrier may cover you at $139 for the same exact Medicare Supplement Plan G. And that's a $50 a month savings or $600 per year. A lot of times it's much more significant than that. So it's important to shop the Medicare supplement coverage around every couple of years. Now we're going to go into Medicare Part D prescription drug coverage. Some plans have no deductible, but the maximum deductible for prescriptions is $615. After that deductible's been reached, you pay a co-insurance or copay for the prescriptions. If your out-of-pocket costs for the year add up to be $2,100, then you reach the maximum out-of-pocket and the plan pays 100% after that. It does reset every January 1st. So Medicare drug plans are through private insurance companies, but they are all approved by CMS, the Center for Medicare and Medicaid Services, to offer the plans. Each plan has a formulary, which is a list of all the prescriptions that are covered by that plan. And then they categorize the medications into tiers. So with tier 1 and tier 2 being generics typically, they're the lowest cost options. Tier 3 and tier 4 are brand name medications, and you'll pay a different cost for each tier of the prescription. Some medications require step therapy, where they want you to try a different medication and see if that other medication works before they'll cover your prescribed medication. Some medications require prior authorization, where they require the prescribing physician to explain the reason that you're getting that medication and say it's medically necessary. Medications can have quantity limits of how much they'll give you per month. And if your medication is not covered by your new insurance, you have a transition process where you can get a 30-day supply. And in that window, you have to look for other alternative medications that are covered by the insurance. You can speak with your healthcare provider. If the healthcare provider does not think another medication would work, you can ask for a formulary exception where the insurance company can decide if they're going to make an exception and cover that medication for you. Prescription drug plans also have a monthly fee based on your income. So if you're on the first threshold here, whatever the monthly premium is for that plan, there's no additional charge. But if you have a higher income, they add on an additional surcharge based on your income from 2 years ago. And again, if you've had a life-changing event, you can have that reduced to your expected income for this year instead of 2 years ago. New Jersey has 14 prescription drug plans offered through 5 different companies. And when you're shopping for Medicare drug plans, Medicare.gov is the best resource to do so. You'll see that there's high premium plans and low premium plans, and plans can have a low deductible. Plans can have up to a $615 deductible, and then the cost of each prescription will vary. So by searching on Medicare's website, you'll see that the difference can be thousands of dollars from one plan to another. You're not locked in with a prescription plan for the rest of your life. Every year you have the option to change from one prescription plan to another during the annual election period, which is October 15th to December 7th. And there's no health questions asked during that time to switch from one prescription plan to another. Which pharmacy you use is also a big factor. So a standard pharmacy will be more expensive than a preferred pharmacy, and it can be significantly different, $50 a month for your 4 medications versus $35 a month at a preferred pharmacy. The Medicare prescription payment plan is now available as of last year. This is where you spread the cost of your medications evenly throughout the year. So the maximum amount you can spend on prescriptions is $2,100. And with some super expensive medications, you could be hit that $2,100 in January. Now you have an option of spreading it evenly throughout 12 months instead of having to pay $2,100 in January. And you're actually billed through the insurance company and not at the pharmacy for your prescriptions. But you have to opt into this program with whatever insurance company is providing your prescription drug coverage. In New Jersey, there is assistance available for those with limited income. So if your income this year will be below $54,943 if you're single, or $62,390 if married, then you can qualify for the PAD program, Pharmaceutical Assistance to the Aged and Disabled. And this program will bring your medication costs to $5 for generics, $7 for brand name, and it will also help pay for the prescription drug plan for you. The only qualification is that you're a New Jersey resident and your income and that you're on Medicare. Assets do not disqualify you from this program, so they do not ask how much money you have in the bank in order to qualify. It's a big help for a lot of people. Not every prescription is covered by PAD. Some manufacturers have opted out of the assistance program, but if your income is a little bit higher than those thresholds, $10,000 higher is the Senior Gold program, where you get a significant discount off of the cost for medications. We can assist people in applying for this program if you reach out to us. Original Medicare does not cover everything. Hearing aids, dental, and routine vision are not covered with Original Medicare. Assisted living facilities and nursing home after a 100-day period are not covered. And custodial home health care are not covered. There's other insurance called long-term care insurance, which can cover any long-term services, but that's a separate application and a separate policy that you have to apply for. Let's go into more details now about Medicare Advantage plans. Medicare Advantage plans are getting your Medicare through a private insurance company, and there's no health questions asked to qualify for a Medicare Advantage plan. You do have to be enrolled in Parts A and Part B of Medicare and continue to pay your Medicare Part B premium. They have to be greater than or equal to what Original Medicare covers, and you must live within the service area that the plan is offered in. So with Medicare Advantage, you'd get an ID card, and you'd use that ID card instead of your Medicare card at the doctor, hospital, and pharmacy. It's Medicare wrapped all into one package through a private company. And the way that it works is you've paid taxes your whole life. The taxes have helped pay for Medicare. Medicare pays the insurance company a monthly fee to take over the risk of insuring you. The insurance company then pays the healthcare providers a good percentage of the medical bills that are charged. You will owe copays and out-of-pocket expenses for each service, but the majority of the bill will be paid for by the insurance. Now, just to give you a feel for Medicare Advantage, I can't give you actual numbers, but the plan premium, Medicare has its own premium, and the plan has a premium to it. And then HMO or PPO. So an HMO is where you have in-network only benefits. Unless you have an emergency, you have to see healthcare providers that accept the plan. Whereas a PPO means you have in-network or out-of-network benefits. Typically, you pay higher costs if you go out of the network, but you do have that flexibility. Now, you're going to pay a copayment for each medical service used. So, see your primary care doctor is going to be a copayment. Specialist is a copayment. Per day in the hospital, you'd pay a copay until you reach the amount of days and then after that, there's no additional charge. If you needed a surgery, you'd pay a copayment. And X-rays a copayment. So each medical service has a cost. And in the summary of benefits, each plan has different costs for each service. And if you schedule an appointment with us, we can go through the details of the plans available in your area. Prescription drug coverage is typically included with Medicare Advantage plans. There are plans available without drug coverage for veterans. If you get your medications through the VA, that's an option for you. And they can include additional benefits that Original Medicare does not have. And they do have a maximum out of pocket. So worst case scenario of how much you can spend per year, the highest amount it can be is $9,350 in 2026. As I mentioned, each county has different plans available, and the plans available in your county can vary drastically. So when you're looking up a Medicare Advantage plan, we want to make sure that it has a higher star rating. The stars are 0 to 5, with 5 being the best. The prescription deductible along with the medical deductible. Medicare Advantage plans can have a deductible for each. And check your medications, just like we did with the prescription drug coverage. Same situation applies with the tiers and the costs in the pharmacy. You should understand whether your plan that you're enrolling in is an HMO or a PPO, and whether it requires referrals if it's an HMO, and that your healthcare providers are all in network with the plan, along with the hospital and surgery center that you want to use. So with Medicare, you have the option to add on a supplement plan and a prescription drug plan. These have monthly fees to them, but they will cover the gaps that original Medicare doesn't cover. Or you could have a Medicare Advantage plan where you get all your Medicare through a private insurance company and wrap it all into one package. If you do not have any credible coverage, so if you turn 65 and don't do anything, you don't have employer coverage, you'll actually be penalized and can only apply for Medicare during certain times of the year. So you can only apply for Medicare Part B when you first turn 65 or first are coming off of employer coverage. If you miss those windows, you can apply for Medicare between January 1st and March 31st every year, and you'll be penalized 10% on top of the standard Medicare premium per year that you didn't have creditable coverage. Same thing for the drug coverage. If you don't have drug coverage, you'll be penalized 1% per month that you didn't have drug coverage, and you can only apply between October 15th and December 7th, and the coverage will begin January 1st. Some people decide they don't want drug coverage because they don't take any medications, but that could change at any time, and a lot of these prescriptions are very costly, and you'll be penalized when you do get a drug plan for not having drug insurance. The annual enrollment period, every year the Medicare Advantage and the prescription drug plans change, and the new plans for the upcoming year are released on October 1st. Then between October 15th and December 7th, you have the option to change your Medicare Advantage or Medicare drug plan for the upcoming year. If you don't do anything, your current plan will continue on for the next year unless it's being discontinued for the next year. The new plan will then begin January 1st. For people on Medicare Advantage plans, they have the option to make a change between January and March from one Medicare Advantage plan to another, or from Medicare Advantage back to original Medicare during that open enrollment period. There's also special election periods if you move to a new service area, so if you move in or out of the state, if you qualify for that PAD program or federal extra help, or if you are admitted to a long-term care facility, you can qualify to switch your insurance at that time. Our company is New Jersey Medicare Brokers, and helping our clients find the Medicare plan that protects their medical, financial, and prescription needs is our goal. There's no charge to work with us, and we are brokers, so we're unbiased on which plan makes sense for your specific needs. We can help you with that plan. Every year the plans change, so we check in with our clients every year about what plan makes sense for their medications and their healthcare providers. And we also offer retirement protection options. Feel free to reach out to us. In the link, we have the option to schedule an appointment, or you can go to our website at njseniorhealth.com. Thank you for listening, and we look forward to helping you with this important decision.